I myself regularly use chiropractic care. I find it's literally just a part of my wellness regime, if you will. There's a lot of chiropractors in the area and lots of things we can learn from each and every one of them. One I stopped by and talked to, David Wimmer at Wimmer Chiropractic, has this device that he can scan our necks with, or actually our entire spine, but in this case we just looked at my neck. We didn't want to be disrobing on camera. Let's take a look.
Well, chiropractic care is basically focused on the alignment and function of the spine and how that relates to the nervous system. Our primary treatment is called a chiropractic adjustment, where we strive to correct those problems and reduce their overall stress on somebody's system.
I think a lot of folks, and I know I did before I began using chiropractic care myself, a lot of folks think, oh, it's just about snapping and popping and moving joints around and all this kind of thing. And I hadn't realized when you're working with the spine, I mean, that is the highway of our nervous system.
Yeah, the spine itself, and that's our course of treatment, but it houses the spinal cord. And that is exactly it. I call it all the time the information superhighway between the brain and the rest of your body. If there's stress there, then that's going to reduce your optimum health potential.
Tell me a little bit about this device. You've got an extra tool here that you use in your practice here. What is this, and what does it do?
This is called a myovision, and what it does is it tests electrical activity of muscles around the spine. We use it as kind of a screening tool to show where there might be some imbalances. Those imbalances are often a good sign that there is some underlying spinal problem or dysfunction, and that can lead, like I say, to that stress on the nervous system.
So there's no real separation then between, it is a musculoskeletal nervous system.
Neuromusculoskeletal system, yeah. It's hard to separate the three apart.
So you've got it. How do you do this? You got these probes or scanners,
kind of just here. Okay. It does a quick scan. It's as painless as us standing here.
Go ahead and
talking
grab one of those and show
us.
So you used to.
We just have some small probes. We put one on each side of the spine. It works, like I say, kind of like an EKG for the heart, testing electrical activity, and we run it along the spine, and then we get a nice picture or representation of how your body's responding to the stress around it.
Now, of course, I was thinking about myself here. You can't do this through the shirt, I imagine. If I loosen up my collar, can you check my neck here, and we'll see how this. All right,
yeah, we would be
loosen
able to
this up a little bit.
Spots in your neck,
I don't know how much you can.
See how you're looking.
I think you can get down to C2 in there somewhere. I believe
we are probably going to be able to get down to C6 or T1 in the very upper part of your back with this.
All right. So go ahead and tell me what.
This is real simple. All I need you to do is turn and face that way for me, and then we're going to just hold these up to your neck. Look straight ahead for me if possible.
So I just feel a little pressure on either side of the neck. I don't feel any weird electrical thing or anything. And a little click there, I guess.
Yeah, and it takes just a second after that click for it to get a balanced reading.
Did I hear a female's voice come out of your computer?
Yeah, she talks to us. She gives us directions, tells us where to go next.
So I heard C4 and C6 as you work down the spinal column there.
T1.
Ah, you got down to T1.
We're going to go to T1 here.
I feel like I'm doing a narration of a golf match or something, whispering into my microphone here. So you're looking on the monitor over there, which I can't see in my vision. And
so I'm looking on the monitor,
okay.
And it tells us when we start to get a stable reading.
Wow, Dave, do I see a little imbalance going on there?
You do see some imbalance. So on one side we see what would be ideal. The other side we have your reading. It's showing us that there's some imbalance in the tension, and especially in the very upper part of your neck where your neck meets your skull, and then in the very lower part. Now,
well, let me ask you, as we're looking at this, and now I'm thinking, this is my left side, correct?
Mm-hmm.
Okay. There seems to be a lot more going on my left side than on my right side. Am I going to see symptoms of that on my left side, or does the spinal cord work in such a way with the nerves that I'll see it on the right side?
It could be either. In some cases, the muscles will actually compensate for a problem that may be in the joints on the right side or due to nerve stress on the right side. Commonly with patterns like this, we may see symptoms such as headaches because the nerves in the upper part of the neck travel up to the head. We may see pain going down into the shoulders or even the arms and hands because the nerves from there, that's where they travel.
How valuable is this tool for you to have for your patients?
Well, I think it's very valuable because what it does is it allows patients to basically see what I often feel during their examination process, so they get a better idea of what actually is going on in their body.
Wimmer Chiropractic is at 2203 Graves Mill Road in Forest at 434-845-9000 and online Wimmer Chiro, CHIRO.com.